Shari Cantor, and I want to welcome you to West Hartford Town Hall. I just want to recognize a few of my colleagues that are here. Town Councilor Barry Walters is here. Town Councilor Tiffany McGinnis. Town Councilor Deb Poulin is here. Is Carol here? I don't know. I also want to thank we have a new Democratic Town Chair and Vice Chair, Peter Andrews and Megan Wallet are just going to give them a little thank you. And welcome. I don't know if Board of Ed, if there's anybody from Board of Ed here. No, I don't see anybody. Okay. And maybe I heard of probate Judge Egan is in the house. I don't know. All right. Well, anyway, and I know we have some stars in the audience that are going to enlighten you and help our commissioner and our insurance examiner. Is that what your title is? Thank you. So, and we are looking forward to hearing from them. But first, I'm here to introduce, and I'm honored to introduce Congressman John Larson. Congressman Larson saw a lot of the challenges ahead, especially with Social Security and Medicare and Medicaid, but specifically Social Security. He has been a champion for the longevity, figuring the best way to preserve Social Security so it benefits not only us but our children and grandchildren. And he has been fiery and really passionate about this cause for a very long time. But under this current administration, it has become an absolute it's broken. It's completely going. I mean, the fact is that Social Security is in danger of a quick death, and I think it's because. I'm not sure, actually, why, but I will say that if you haven't heard Congressman Larson challenging DOGE on the cuts to the agency staff that was being made, you should. It was April 28th, 7th, something like that, I think.
Looked like I was having a stroke.
Yeah, pretty much. And challenging why are cuts being made to this organization, to this agency that it concludes, I think, is 1% of the total budget of the agencies and serves 70 million people. But what is happening in this administration is clear. One is it's so self-serving, and it is cruel, and it is looking at, and I heard this on a podcast, and I think it's very true. It's taking low income and transferring it to high income. It's taking our young people and it's sacrificing them and investing in older people, but not older people in need, and older people that are very, very wealthy. And it is taking the future, sacrificing the future, and trying to bring us back to the past. That's science, that's environment, that is so many different things that are bringing us back in a way where we are actually going to we are all going to go back, and it's going to hurt. And so this is a fight for our future. This is a fight for the democracy of our country, and we need warriors that are going to stand up, know the path, know the fights to have, and I'm so honored that our Congressman Larson is going to fight that fight. Congressman Larson.
Thank you, Shari. What a great job the mayor of West Hartford does. And thank you so much for being here. And all the members of the council and the Board of Education, and I know members of the General Assembly, as my dear friend and former Senate President and Senate President Pro Tem, Kevin Sullivan knows. Of course, this is the end of the session, so they're pretty busy as well. And we do a number of town halls, as we call these, and meetings in a variety of ways. This is my favorite. I would rather see people face to face, because I think That's the way you learn the most and get to hear from them directly. So what the goal is tonight is normally we had scheduled this and we were going to do a discussion about Social Security and preserving and saving that and why it's so vitally important now and in the future. But a funny thing happened on the way to the event. Over the last several weeks, we spent far too much time debating both in the Committee on Ways and Means, which is in charge of taxation, and then on the floor of the House. But we spent that time after midnight debating and then ultimately, unfortunately, passing a budget. There is, if you had to use one word to describe the budget that the House just passed, it can be summed up in one word: cruel. And I think when the American public gets all the facts, I think they will overwhelmingly agree. Now, the bill has passed the House, and I'm going to spend a little time on process. I know that a lot of people yawn when you say process, but it is important that we understand the process and why they decided to vote after midnight. And that's largely because the public isn't watching then. But ultimately, the public is aware and will become aware, because I think a number of members will be holding town halls, teletown halls, all kinds. I've been on in several different districts with colleagues as well, what we would call frontline colleagues, talking about both the budget and also the reform that's needed to Social Security, and also putting a halt to what they're attempting to do. We're also very fortunate tonight that we have, Commissioner Andrea Barton Reeves, who's here, as well as Jennifer Cavallaro, State Operations Director, because for Mosaic, right here out of West Hartford, so that it's one thing for me to talk about things. It's another thing to understand the impact that it's going to have directly on the state and the communities here. And then after that, what we'll do is open it up to questions that you have, and any difficult ones I'll give to the commissioners or my staff, so we'll be able to handle that pretty easily. But first, from a process standpoint, the way that this bill started has to go through the Ways and Means Committee, which has jurisdiction over all taxation. And instead of having a normal public hearing process over time, you may have heard about the One Big Beautiful Bill. Hardly what I think most people would describe it after they read it, but nonetheless, that was the message that our colleagues on the other side had placed on it. But if it was so beautiful, why were they taking it up after midnight? And I think the reason becomes pretty clear when you go through these posters. And the reason I said the one word is cruel, you can cut through everything and it comes down to this. If you're creating a budget that is going to reward billionaires with tax cuts. Now, there's nothing wrong with tax cuts. We could have worked together on tax cuts that would have been beneficial to all Americans. Now, our colleagues will tell you that, well, no, everybody gets a tax cut under this proposal. In fact, they do. except that 70% of it goes to the nation's wealthiest 1%. That's not fair by any measure. But I want you to keep that thought in mind, that here it is, the purpose of this. If you go back to 2017, when Trump passed his first tax bill, he takes great pride in that, and that's his legacy. And at that time, the same thing. People at the top were rewarded. Other people got tax benefits, but not nearly as much. I think if you can read any of the charts over here, you'll see that in this one, a millionaire would get something like $89,000, and a person earning $50,000 and less gets something like 72 cents a week. And that's hardly fair, and especially in post-COVID and this inflationary period. Who's hurt the most and who needs the most relief? I think the people at the very top are going to be able to persevere through all of this. But it's the families, the working families that are struggling, that need our help and support and relief. And Democrats were prepared to do that. And Rich Neal from Springfield, we put forward an amendment, and the amendment was very simple and clear. We're for the same tax cuts, except here's what we think should happen. We think that billionaires should go back to the same rate that they were paying under, let's say Bill Clinton and Barack Obama. Now, why do I mention Bill Clinton? Well, because that was the last president that both balanced the budget and reduced the national debt. Like saying reduce the national debt, not having a national debt. Barack Obama was able to drop that national debt. The tax cut of 2017, because it was not paid for, increased the national debt, as does this tax cut as well. But what stings and hurts the most is how they pay for it. And they pay for it by cutting the nutritional program for the nation. Now, you've all probably heard of SNAP, but sometimes when I'm at Augie and Ray's and I'm talking about SNAP, they look at me, what are you talking about? When you say we're talking about the essential nutrition that the elderly, that the disabled, that veterans and children receive, has had the largest cut ever in the history of the country. A far cry from the wealthiest nation in the world, the greatest nation in the world, wanting to provide tax cuts for billionaires at the expense of kids going to school hungry. There is no other way to describe that than cruel. And the other pay for, which the Republicans have tried to repeal the Affordable Care Act because, God forbid, that we provide health insurance for individuals. And in this case, 14 million, actually 13.7 million people will lose their health insurance coverage in this inflationary time. And people that are fortunate enough to hold on to it will see their prices rise, as if they don't have enough to contend with during this time. And again, why? What were the decisions that have to be made? Now, we could have provided a tax cut. Does this sound fair to you? Take the tax cut on the very wealthy, and again, that's people earning over 750,000. Raise your hand if you're making over 750. All right. Raise your hand if you're making over 400,000. You know, funny thing, Kev, you'll appreciate this. Every audience I've been in, no one has ever raised their hand except once in my hometown in East Hartford. And I knew the guy. And he raised his hand proudly, and I went like, "You're making over 400,000?" He said, "No, but it felt good to raise my hand." And I can understand that, but I think you get the picture here. So what we said is that everybody 400,000 and below should receive a tax cut that's proportionately fair to deal with this post-COVID, global post-COVID inflationary period. And the wealthiest recipients should go back to pre-2017 or just let that bill lapse, because it lapses in 2025. Go back to the rate that they were paying then. None of them were in bad shape back then either. And some would argue they weren't even paying their fair share then, but that would pay for all of those tax cuts. Doesn't that seem more fair? People earning 400,000 and less getting a tax cut proportionately delivered for those who need it most. But I think it's a fairer way to do it. And so that's the situation. And that's why you can understand why they really wouldn't want to debate this in the committees or in the public over a long period of time. But fortunately, in a democracy, as you know, the bill passed the House of Representatives, was taken up when Rich Neal, the Democrat, finally spoke. It was 4:15 in the morning when we made our case against the Republican proposal, offered what we think was a fair alternative. But the more than 529 amendments that Democrats offered, a majority of them were not taken up, and others were ruled out of order or non-germane. So I didn't feel that I could have a public forum and come out and just focus on Social Security, but in that budget, what they've attempted to do to Social Security and what Elon Musk had foreshadowed they would do is already make cuts within the Social Security Administration, already eliminating more than 7,000 employees, already making it more difficult to get phone calls, closing regional offices. In the nation's #1 anti-poverty program for the elderly and for the children of this country. More than 40% of the 70 million plus Americans who participate in Social Security, more than 40%, this is the only benefit they have to survive and to sustain themselves on. In the wealthiest nation in the world, people should be outraged and demanding, because the last time that Congress extended across the board Social Security benefits, Richard Nixon was president of the United States. That's more than 50 years ago. People go, well, wait a minute. Didn't Tip O'Neill and didn't Ronald Reagan and didn't Bob Dole get together? Yes, they did. Remember, Ronald Reagan wanted to privatize it. Bob Dole, a Republican, said, no, that's not a wise idea. And Tip was against it and fought it every single step of the way and ultimately won. But with two Republicans, the compromise with Reagan, engineered by Dole, was to raise the age from 65 to 67. And everyone says, well, that sounds like a reasonable idea. And lo and behold, the Republicans have said currently, yeah, we think that we ought to raise the age again. We ought to raise the age to age 70. Let me tell you what raising the age does. For every year you raise the age, that's a 7% cut in benefits. So not only would you be working longer, and I think it's a great thing that people are living longer, but should they live longer on less with an across-the-board cut of 21%? How does that make any sense at all? Back in 1983, it was a compromise to save and extend the solvency of the program. But that's not the case today. And so to make clearer, I think, how this is going to impact the state, I'd like to call on Commissioner Andrea Barton Reeves to make her remarks on the SNAP program, if you would. Thank you so much, Commissioner, for being here with us.
So thank you, Congressman. I appreciate the opportunity to be here. I wish it were under better circumstances. So as I heard you tell the story about what happens after midnight, I wanted to share a story. My parents are immigrants from Guyana. All my brothers and many of my cousins and I are first-generation Americans. And my mom would set a curfew for us to come home. And if we asked to come home after midnight, she would say, there's nothing good that happens in the street at midnight. You need to be home. And she was right. And I reflect on that today because the idea of having self-regulation, of thinking about what happens to other people regarding the decisions that you make, of understanding the impact of the choices that you make on other people's lives just seems to have completely disappeared in Washington. And it's not only cruel, it's really just inhumane. So in our state, I'll talk a little bit about Medicaid. We provide Medicaid supports to 1.2 million people in the state of Connecticut. That's not just people who actually are covered under what we call our Husky program. It's also people who are in nursing homes and hospitals and receive home and community-based services so that they can remain active and engaged in their community while they age in place. So the cuts that are being proposed under Medicaid, particularly in our state, which is known as an expansion state, and that means that we took advantage of the federal government's generosity at that time to match 90% of the money that we spend on a particular population of Medicaid to add 335,000 people who did not have health insurance to our Medicaid rolls. And because we also, with other state dollars, provide coverage for children who are not documented, we will lose $250 million of that aid because we made that decision. So not only will the 15,000 children who we cover now, who we provide very basic care for, vaccinations, those kinds of things, we will lose coverage for those children. We will also lose another $250 million in coverage, even if we cover one person. And that means 102,000 people will lose coverage with that amount of money lost from our budget. And that's just Medicaid. The other thing that's happening with Medicaid is something called work requirements. So right now, you do have to either search for work or work a minimal number of hours in order to qualify for Medicaid benefits. It's not an onerous burden, and most people meet it. People who aren't meeting it are people who can't. They are disabled or they're outside of the range where you have to work. That age is now 54. The current proposal raises the age to 64. I can tell you the closer that I get to that age, I don't know if I want to be doing that, and I'm sure that many people feel the same way. But if you are disabled, if you're caring for someone who has a disability, if you are caring for a young child, that age of caring for a child has now dropped from 18 to 7. So you can see there are very deliberate ways in which this program and all of these programs are being redesigned to eliminate coverage for people so that the wealth can be transferred, as your mayor had said and as the congressman pointed out, to those who are the 1% of the 1%. It's unconscionable for us to even contemplate this kind of cut. It's a level of cruelty that I will tell you that the team that I work with, we can't even comprehend. So when we think about the way that Medicaid is designed, there are mandatory coverages that the federal government requires us to provide, and then there are some that are optional. And when I tell you it's optional, you're going to think that I'm crazy, but I'll tell you, dental, vision, pharmacy, physical therapy after surgery, cancer treatment is considered optional care under the Medicaid program. Those are optional. Because our state is run by people who have a heart and is humane, we cover those things under Medicaid. But there are many states now with these draconian cuts on the table are wondering whether or not they can do that anymore. We have not come to that place yet. We are waiting to see what happens in the Senate, but we're already not sleeping, thinking about what it is we might have to do, because there is not a state in this nation that can cover a $250 million gap year over year over year, and it will just continue to grow. It's not as if we're talking just about 1 year. Once these fundamental changes are made to the way the program works, they are made in perpetuity. And that is really what I think is lost, as we're really, I think, deliberately being clouded by this idea of what's happening right now. The other thing I want to talk about with respect to Medicaid is what's known as the 6-month eligibility review. Once you apply for Medicaid and you're approved, we conduct a review. It's required every year. Now, within the bill that's now passed the House, it's on its way to the Senate, you will have to renew your eligibility every 6 months. If you've ever applied for Medicaid, this is just incomprehensible. It is a very onerous, complicated process in large measure because there are already so many federal requirements around the amount of information that we need to gather. And we're already, I will tell you at DSS, a little embarrassed by that because we get a lot of feedback about how difficult it is to apply for Medicaid. And we're very apologetic about that, but also will tell you that it's a lot of federal requirements that require us to do that. The specter of having to do this every 6 months, particularly for a person who has a permanent disability or a child that has a permanent disability or a person who's already over the age to qualify for Medicaid, it's just a burden that really is just completely unnecessary, and it's specifically designed for people to give up and fall off the program and not be covered. That's exactly what it's designed to do. And when that happens, we are talking millions of people across the country who will be without care. But care still has to be rendered. And where are people going to go? They're going to go to hospitals and receive care. They're going to go to federally qualified health centers. They're going to go to urgent care centers. It will still cost money, and people's lives will still need to be saved. There's no solution in Washington for this. When you pose the question to those who are making these kinds of decisions, they have no answers as to where people are going to go to receive care. Because the answer is they don't care where people are going to go. That's the answer. But they're brave enough to pose this, but not brave enough to actually deal with the consequences of the choices that they're making. Now, you asked me to speak about SNAP, and I will. Right now, the way that SNAP works is that each state shares 50-50 in the cost to administer the program. We spend about $154 million to administer SNAP in the state of Connecticut. We spend about $880 million in SNAP benefits in this state. The proposal is that we now share up to 75% of the cost to administer SNAP. That is another $250 to $260 million. It's an enormous amount of money. The other benefit, the other cut that's being proposed is that we also then share in the amount of money that is paid in SNAP benefits, which is now completely federally funded. As I mentioned before, we pay $885 million in SNAP benefits. If we're asked to share any part of that, that money has to come from somewhere. And the question is, where does it come from? Does it come from schools? Does it come from roads? Does it come from senior citizens? Where does it come from? Those are decisions that people need to make. And again, when you make these kinds of proposals, as my mother said, you have to think about the consequences of the choices that you make after midnight, and you have to be willing to live with them. But what they're asking is for states to live with them, because the cuts aren't necessarily coming from the federal government. What they're doing is redesigning the way the program is administered so that states have to bear the cuts 100%. That's what's happening. There really is no way to cover this gap other than for us to figure out ways in which we can make draconian cuts within the state of Connecticut. How do you do that? How does any state do that? When I talk to my colleagues in other states, the decisions that they're making is perhaps we can't offer SNAP anymore. Perhaps we only offer the very basic in Medicaid. Perhaps everyone only gets a certain amount of Medicaid as if they get a stipend. Maybe you just get $1,000 worth of benefits, so you make that work through the year. These are the kinds of decisions that have now been foisted upon us state by state, while those in the 0.5% continue to grow wealth. It's unconscionable. It's shameful. There is nothing democratic about what is happening here. But I can tell you that we will continue to fight as hard as we possibly can to make sure that every person in this state has the dignity that they deserve, because health care is a human right. To not be hungry is a human right. And everything that we can do to make sure that people have what they have and have what they need, and that children and our elders and everyone else in this state has what they need to live in a dignified way, is exactly what we're going to do. And I will fight with everything that I have, and I think the congressman will too. Thank you.
Thank you, Commissioner. Now, we often get people say, well, geez, I just don't understand why in Washington, D.C., people just can't work together and get things done on behalf of the country. And indeed, there are a lot of examples of how that happens. But sometimes, and especially in this case as it relates to the one big, beautiful bill, it's all about the tax cuts of 2017 and making them permanent and how they're paid for. And this is what they came up with. Now, so we find ourselves in a situation, because it's a Republican bill, always calling out the Republicans. I want to read to you what one brave Republican of the two that voted against it said on the floor, and he deserves a tremendous amount of credit and took a lot of heat and stood up to Donald Trump and stood up to his own caucus. Here's what Representative Massey had to say. I would love to stand here and tell the American people that we can cut your taxes and increase spending, and everything is going to be just fine. I can't do that because I'm here to deliver a dose of reality. This bill dramatically increases the deficit in the near term, but promises our government will be fiscally responsible 5 years from now. Where have we heard that before? How do you bind a future Congress to these promises? This bill is a debt bomb ticking. Congress can do funny math, fantasy math if it wants, but bond investors don't. This week, they sent us a message. Moody's downgraded our credit rating, and the bond investors who buy and finance our debt demanded higher interest rates on the 10-year note, the 20-year note, and the 30-year note. Well, what does that mean? Very soon, the government will be paying $16,000 of interest alone per U.S. family. What are we telling them? Instead of taking care of the problem, we are going to give them a $1,600 tax break. Under the taxing and spending levels in this bill, we are going to rack up another, say, $20 trillion of new debt over the next 10 years. I am telling you, it's actually closer to $30 trillion of new debt in the next 10 years. Mr. Speaker, we are not rearranging decks on the Titanic tonight. We are putting coal in the boiler and setting a course for the iceberg. If something is beautiful, you don't do it after midnight. Mr. Speaker, I oppose this bill. Representative Massey. Now I'd like to call upon Jennifer Cavallaro, the State Operations Director for Mosaic, and who will remark on the impact on people with disabilities.
Good evening. I will say I had to resonate with Commissioner Reeves' comment about nothing good happens after midnight. In our house, nothing good happened after 11 p.m. So I certainly agree with both of those comments. I'm grateful for the opportunity to speak tonight about an issue and individuals that are so important to many of us, I'm sure, in this room. I'm the State Operations Director for Mosaic in Connecticut. We're a nonprofit healthcare organization providing home and community-based services to more than 200 individuals in the state of Connecticut, and we employ more than 400 direct service professionals. Many of those programs are right here in West Hartford and in the Congressman's district. Mosaic empowers people with choices about how, where, and with whom they spend their days through home and community-based Medicaid waivers, so our services are funded by Medicaid. We're most appreciative of Congressman Larson's ongoing advocacy to preserve Medicaid for those who need it most, including people with intellectual and developmental disabilities. Mosaic services are 96% Medicaid funded. The proposed changes in the fiscal year 2025 budget reconciliation bill would be devastating for the people that we support. It's not just a line item on a budget. For people with disabilities, it can be the difference between independence and institutionalization. The provisions would reduce services for people who need them, including those with IDD and other diverse needs. Even though they're not the intended target, and how often do we hear that it's not about those people, it's about those people that are taking advantage of the system or they want something for free. I think that that's probably about 1% of those who are receiving Medicaid. We should be investing more into the Medicaid program, not reducing it. Community-based services like those that Mosaic provide not only improve people with intellectual and developmental disabilities' quality of life, but they're more cost-effective than institutional care. Nonprofit organizations providing services save the state and the federal government money, and in the state of Connecticut alone, nonprofit human service organizations such as Mosaic are saving the state over $1 billion a year by keeping people in the community. The proposed changes would result in longer waiting lists for home and community-based services. We already have more than 3,500 people on a waiting list, not just with individuals with intellectual and developmental disabilities. So making changes, as this bill is calling for, would make those waiting lists even longer. Often these individuals are waiting in institutional settings, or they're home with caregivers who really cannot provide the care. A reduction in Medicaid would not only harm the individuals that we serve, but it also hurts families and it hurts our communities. The reconciliation bill reduces federal reimbursement, which Commissioner Reeves spoke about, and that impacts us in the state of Connecticut. We have to make up the difference, as was mentioned. Historically, states have done that by cutting services that are not required. Home and community-based services fall into this category. If these services are reduced or eliminated, more than 11,000 people with intellectual and developmental disabilities in Connecticut would need to have their needs met in other ways. Some would be reinstitutionalized, others might return home to unsafe situations. Institutional care, such as care provided in a nursing facility, is required. As Commissioner Reeves spoke about, we have certain services that we have to provide. Home and community-based services is not one of those. However, nursing home care is significantly more expensive than services provided in the community, and it's been estimated by Leading Age's Long-Term Services and Support Center that even a 15% reduction in home and community-based services actually would increase spending $467 million. Additionally, these proposed changes to Medicaid would reduce access to healthcare services, including medical treatment, therapies, medications, mental health services. Individuals with intellectual and developmental disabilities are already disproportionately served. They have delays in care and their medical needs. These proposed changes would only further those delays. The changes to Medicaid also result in the loss of independence and a poorer quality of life for people with disabilities. They become socially isolated from their peer group. They become more dependent on their families and their caregivers. This leads to a decline in physical and mental health, which in turn results in more hospitalizations, greater care needs. It also negatively affects our workforce. Family caregivers would have to leave the workforce. The proposed changes surrounding the new work requirements and mandatory cost sharing may lead to a loss of Medicaid coverage for caregivers and direct support professionals. Many of our direct support professionals are receiving some sort of Medicaid benefit for health care. This only worsens a workforce shortage that is already at an all-time high. And we're not just talking about numbers when we talk about proposed changes to Medicaid. We're talking about real people with real hopes and real dreams, such as Amanda. Amanda was living at home with an aging parent. Her parents had kept her home, provided love and care, but her dad, who was surviving, was getting older. He had his own healthcare needs, and Amanda's needs were getting much greater than he could provide alone. He was connected with Mosaic. Mosaic helped match Amanda with a community home that met her needs with her peer group, and now she lives in a home with several other women her age. Dad can focus on his healthcare needs. He can focus on being a dad and not a caregiver. And Amanda's able to live in the community with her peer group, independence, and successfully living at home. When we make these changes, we're impacting people like Amanda. And we appreciate certainly Congressman Larson and all of you that are supporting people like Amanda and everybody who requires Medicaid. Thank you.
Thank you again, Jennifer. Greatly appreciate that. Our speakers will be here also to answer questions that you might have as well. And you may recall that Trump, during the campaign, talked about how he was going to eliminate the tax on Social Security. That's a good proposal. Now, the last time he was president of the United States, it was in our bill for the 4 years he was there, but he didn't act. But there was a difference between his proposal and ours. His proposal wasn't paid for. Ours was. What does that mean? Well, if you don't pay for it, that's a $998 billion, almost $1 trillion hit on the Social Security Trust Fund. So how did we get to this point? We have to take a step back because he's no longer there, but you're all familiar with Elon Musk. And Elon Musk was charged with the responsibility. You remember what Trump asked him to do? He said, I want you to find $2 trillion in cuts that need to be made because there's too much government. And we can find all the fraud and abuse and waste that exists out there, and we're going to cut that budget. Well, I don't know anyone who's in favor of fraud, abuse, and waste. But funny thing about the specifics on that, they were pretty scant. But what I will say about Elon Musk is at least he was honest. When he went on in talk shows and said, well, 70% of the federal budget is comprised of military spending, Medicare and Medicaid, and Social Security. He said, so we are obviously going to have to look in those areas. And then he talked most about Medicare and Medicaid and Social Security, while Trump was denying that they're ever going to touch Social Security or Medicare. And he said it, he says, oh, I said this on the campaign, and that's not gonna happen. And then wouldn't take any questions about Elon Musk. And some of you, like I said earlier, may have saw we called him and introduced something that's called a inquiry resolution, which is a tool that Congress can use when the majority will not allow the minority to get their questions answered. You can call them before the committee of cognizance. So we called Elon Musk, and the committee has to respond by setting a time and date. And they did. Again, before Congress normally comes to order, they did it at 8 in the morning. And lo and behold, when we got there, there was an empty chair where Elon Musk was supposed to sit, because he flatly and boldly said he doesn't have to answer to anyone other than Donald Trump. That's what caused the anger. Nobody is above the law. No, everybody has to answer questions about their so-called findings. If there's so much fraud, waste, and abuse, why aren't you here in front of us telling us about it so that we can work with you to make sure we eliminate the fraud, abuse, and waste? But you're calling for major cuts. Why? What is your rationale? And you're closing regional offices, laying off people. Why are you doing this? How are people receiving this? And members of Congress, how is your district and the people within your district reacting to the nation's #1 anti-poverty program for the elderly and for children? But as all of you know, Social Security is not just a pension plan. It's a spousal, widow, dependent children, and disability program as well. There is no insurance program like it. We come from an insurance capital of the world. They all support Social Security with good reason. They understand its benefits. And there's no way that you could go out and buy, I challenge anyone to go to call up tomorrow any company and say, yeah, I'd like buy an insurance policy from you that has a pension, a disability benefit, covers spouses, covers wives, and also children. Could you give me a price on that? And what kind of a bill would you call that? Of course, it doesn't exist, because the genius of Franklin Delano Roosevelt is that he understood, and what Social Security really is the safety net of capitalism and entrepreneurialism. For my Republican colleagues, I remind them all the time, we should be expanding and making this grow, because this will allow people to continue to take risks, because if they fail trying, the people who are working for them and themselves are not hurt. There's a safety net there for them that continues to provide, as Social Security has. And look, you don't have to go back to 1929 and the Great Crash. We can go back to 2008 and 2009, when people saw their 401k become a 101k. And during that time, Social Security never missed a payment. Never has and never will, as long as the American people and the people they send to Congress stand up and fight for it. It's been over 50 years. It needs to be expanded to reflect the times we are living in. And with 10,000 baby boomers a day becoming eligible for Social Security, the demand is prescient. Congress must act. Thank you for being here tonight. We're going to throw it open to questions, and we may not get to everyone's questions, but I should have said this at the outset. Please, and Connor Quinn, Chief of Staff, I think he's somewhere here. There he is. Please always feel free to call our office for information and stuff. And a lot of times when we're in town halls like this, people have questions and they say, I feel uncomfortable asking this, but I actually had things. Call our office. We're here to help you.